Hi, I'm Professor Donna Gurley. Welcome to Part 1 of Module 20, Public Health Workforce. In this first part, we will discuss the workforce within the field of public health. You will learn about the strengths, challenges, and opportunities within this field, and hopefully start to envision where you will fit in when you graduate and become a public health professional. I've been a public health professional since 1986. I've worked in the fields of environmental health, policy, healthcare, and academia, and I've never had a day where I thought, oh, I really don't want to go to work today. Why? Well, that's because I enjoy what I'm doing. Public health is a dynamic field where no day is the same. And that's because people aren't the same, the environment isn't the same, and circumstances aren't the same. But I don't have to sell you, right? You're already working towards a rich, exciting, and fulfilling career in public health. Up until the mid-20th century, public health issues in the U.S. revolved around infectious diseases, primarily due to unsanitary conditions within the environment. However, as things like sanitary sewers, drinking water distribution, pasteurization, refrigeration, and vaccinations were implemented, infectious diseases rapidly declined and longevity significantly increased. In the second half of the century, public health issues evolved into lifestyle-related diseases like heart disease, cancer, and diabetes. And during this time, policy changed that no longer required assessing and reporting to identify future public health workforce trends. Public health has a symbiotic relationship with healthcare. They depend on each other to keep the public healthy. While public health focuses on prevention, healthcare focuses on diagnosis and treatment. Both are needed for population health. As we studied in Module 17 this quarter, policy can be enacted at multiple levels. However, state agencies take on the role of oversight for the local agencies. This means that local public health employees do the field work, and state employees are typically in administrative roles. When people ask me what I do, and I say, I work in public health, most of the time I get a strange look because they aren't sure what that means. I think this is due to an identity crisis created by the following issues. There are many standard operating classification system job titles, over 50. Many based on outdated civil service job titles and job descriptions. Public health includes a wide variety of types of jobs and different settings, including a lot of different people who deliver these services. In 2011, the CDC, HRSA, and the Public Health Foundation commissioned a study of the public health workforce. They discovered the following issues. Many uncoordinated studies were conducted using a variety of data collection methods, which means there's no standardization, right? A lack of professional classification schemes and categories for public health jobs, the absence of professional credentialing requirements, and a workforce that is discipline specific, such as medicine, nursing, or behavioral health, but is uneducated in the field of public health. This study and others have found that there are unique strengths to the current public health workforce. It is a diverse group of people representing different age groups, ethnicities, religions, and there are a large number of career fields represented, such as nursing, dentistry, medicine, veterinary science, psychology, among others. Also, people in the field of public health tend to be service-oriented, meaning that they are interested in serving the public to improve the health of the population. I can't think of any other field that can say this, even healthcare, particularly since public health incorporates a variety of other disciplines into it. This is a collage of the victims from the 2015 massacre that occurred in December in San Bernardino. Most of these people were environmental health professionals, a subset of public health. As you can see, this group is very diverse in age, gender, and ethnicity, and represents the diversity within public health. Things are changing within public health, and a few of these trends include downsizing of state agencies, an aging workforce that is gearing up for retirement. Government is shifting from providing clinical care to giving that responsibility to larger healthcare organizations. Funding is disappearing from public health preparedness activities, and leadership positions have a notoriously high rate of turnover. Most public health agency leaders stay for an average of less than 3 years. As things change within the public health workforce, other areas growing within public health include informatics, and that includes GIS, genomics, communication, cultural competence, community-based participatory research, global health, public health policy, law, and ethics. So with a Master's of Public Health, these areas can support your degree and make you more marketable. So how do we grow the public health workforce? Some suggestions include credentialing the workforce. Remember how we've talked about the CPH exam? That's the first step. Another is increasing education requirements such as bachelor's, master's, and doctoral public health degreed professionals. Providing public health training and continuing education so that the workforce stays current in the field. And helping the current workforce to develop into good leaders, not just good technical professionals. So, where will you fit into the future of public health? Getting your CPH credential after PCOR is a good place to start. Then targeting an area of future growth and obtaining skills in that area. These things, along with a good attitude and hard work, will make you very marketable when you graduate and begin your career in public health. Thanks for watching.